Well, welcome back. In March is Endometriosis Awareness Month, and 1 out of every 10 women face this painful disease. Endometriosis is a disease where tissue similar to the lining of the uterus grows outside the uterus. It is especially common among women in their 30s and 40s and may make it harder to get pregnant. This week, Australian conservationalist Bindi Irwin revealed she has been suffering with endometriosis. The 24-year-old said doctors found 37 lesions, some of which were very deep and difficult to remove. But the mother of one says she is on her way to recovery. Irwin is just the latest celebrity opening up about struggles with endometriosis. Comedians Amy Schumer and Lena Dunham and actress Padma Lakshmi have all talked about their battle with the disease. So joining us this morning is Dr. Gregory Lewis, a minimally invasive gynecologic surgeon with UF Health. Thank you so much for being here to talk about this.
Sure. Thanks for having me.
Can you explain a little bit more about what endometriosis is and how common this diagnosis is?
Right. As you had mentioned, endometriosis is a medical condition in which the tissue that lines the inside of the uterus deposits itself outside of uterus, typically in the pelvic area, but it can involve other organs such as the bowel and the bladder. Usually deposits also on the ovaries and cause patients significant pain. About 1 in 10 or 10% of women of reproductive age will be affected with this condition, endometriosis.
So we've heard a lot about pain that comes with this. Can you talk a little bit more about what exactly some of the symptoms are that women can watch out for too?
Certainly. So patients with endometriosis, the symptoms are wide and varied, and some patients are asymptomatic, meaning they have endometriosis and they never know they have it until we do surgery for other reasons and recognize that they have endometriosis. But the vast majority of patients will have some form of pelvic pain, painful periods. They will also experience infertility, heavy periods as well, pain during sex. These are some of the symptoms that patients with endometriosis will experience.
Can you provide any insight as to how a woman may get endometriosis? Like, for instance, is it hereditary by any chance?
Right. The exact cause of endometriosis is not fully understood. However, there are several theories that have been put forward. One theory suggests that during menstruation, some of the endometrial tissue in the lining of the uterus flows backwards and deposits itself on the fallopian tubes or in the pelvic cavity. Other theories include immune system dysfunction, genetic factors, or environmental factors. So to your point, our question rather about it being hereditary, yes, we recognize that if a patient's mother or sister has endometriosis, they are likely to develop endometriosis, but it does not necessarily follow that pattern, or not because you have family members with endometriosis doesn't mean that you'll get it, but it is a higher likelihood that that would be the case.
And before we go, can you quickly talk about some treatment options that are available to women?
Certainly, patients with endometriosis, we trying to find out what their goals are. If it's pain management is a big part of endometriosis management, and we try to start managing patients' pain with non-steroidal anti-inflammatory medications such as ibuprofen or naproxen. And these are medical management options. Other medical management options would include hormonal therapy, such as the use of oral contraceptive pills for the hormone that they contain, and these can help to stunt or decrease the growth of endometriosis tissue. The mainstay, however, is usually surgery, laparoscopic surgery, where we do try as best as possible to excise or remove these lesions from the pelvic cavity, from the ovary, from the bowel or the bladder if these areas are involved. And also in terms of treatment, there are reproductive endocrinologists who will help patients who are suffering from infertility as a result of endometriosis.
Dr. Lewis, thank you so much. Have a great day.
Thank you so much for having me.